in advance. Thank you, Evan. And I'll introduce myself. My name is Louise Langhire, and I use she and her pronouns. I am honored to serve as PHE's co-founder and CEO. And today I'm really thrilled to be joined by some incredible health facilitators, Shelby, Weinstein, and Kavi, Kaushik. We'll also have some of our extraordinary curriculum staff on our call, Dr. Iko, Canillas-Myles, and Kavita, Shah. I'm looking forward to giving you a quick overview of what we do at Pure Health Exchange, why we do it, and where we continue to look ahead before turning it over to those who really make it happen, who I'm most excited for you to hear from and see in action today. So our mission at Pure Health Exchange is to build healthier communities with young people. Together, we create education opportunities for peers to share the tools and resources young people need to make healthy decisions. Those of you who've been with us for a long time will notice that this is slightly different. We've recently expanded our mission statement to fully encompass the virtual world that we're in and the potential to actually reach more young people than ever before on their terms. We've historically reached young people by training college students to facilitate a skills-based health curriculum in under-resourced communities. But with remote learning, we pivoted and branched out in many different ways, including live and pre-recorded virtual workshops. And as some of you know, we're also exploring and almost ready to publicly launch our work working directly with young people, no schools needed. We can wait to share more about that very soon, but today we're focused on our in-school workshops and curriculum and really giving you a closer in look at what that looks like, especially this year where you can't join us in the classroom live. We do what we do because we know we need to do more for young people, especially Black and Latinx young people, and especially now. The National 4-H Council reported in May that 70% of young people across the country are struggling with their mental health, 55% are experiencing anxiety, 43% depression. 79% of the young people surveyed wish that there was an inclusive environment for them to talk about their mental health at school. Today, we want to show you how our passionate and incredibly engaged facilitators are filling that need by connecting with young people virtually, and how our curriculum supports healthier communities by building skills and connecting young people to resources. And now, without further ado, I'm really excited and honored to turn it over to Iko, Kavita, Shelby, and Kavi.
Hi, everyone. So before we jump into the slide deck, there we go. Excellent. So hi, everyone. My name is Dr. Iko Canillas. So first of all, thank you, Louise. I love the introduction. Thank you for the setup and everything. My name is Dr. Iko Canillas-Myles, and my pronouns are she and her. And looking at Kavita.
Sorry about that. I'm Kavita. I'm the Senior Manager of Program Design and Development for PHE, and my pronouns are also she and hers.
So I'm going to go ahead and take this first part of our conversation, which really talks about how Pure Health Exchange seeks to build in youth voice. But before we get there, just to give you some background information, as you know, Pure Health Exchange seeks to center relationships. So to center relationships, let me tell you a bit about myself. I am going on my third year here at Pure Health Exchange, and was brought to the work because of the focus on building knowledge, skills, attitudes, and intention for younger people to act for their health. I am the Director of Design and Development, and my background is in education psychology. So if you're wondering where that doctorate came from, that's where it comes from. I currently work with the Programs and Strategic Learning National team at PHE, and we are the folks who design, develop, measure, and innovate programs and products that support younger people in acting for their health. I don't know about the rest of you, but I buried my memories of ninth grade a long time ago, and let's see why. In the next slide. So, click, click. This is ninth grade eco. Yay! I showed this picture to my wife, and she was like, why are you so angry? I don't know, ninth grade maybe. That being said, like me, ninth grade has changed since the last time I was there. And so me being the expert on what is interesting to students and what will center relationships and what will center equity, I'm probably not the best expert on that. Probably important to talk to the ninth graders themselves. So moving to the next slide. So I'd like to hear from you really, really quickly. So I'm gonna ask you a question, and I would love for you to put a 0 in the chat box or a 1 in the chat box. So if you received health education in high school, whether it be 9th grade, 10th grade, whatever, can you go ahead and drop a 1 in that chat box? If you did not receive health education in high school, can you go ahead and put a 0? Awesome. So I guess it probably would have been better as a poll because then I could have had percentages, but it seems like there's some mixed responses. Evan, is it okay if I ask from the group to share out a little bit, or should I just use the chat box for that? So let's do this. If you said yes, that you received health education in high school, what was that like? Was it in 9th grade? What was your experience? Just really briefly in the chat box. If you didn't receive health education, can you say a little bit about if it wasn't accessible or available in your high school, or if you just didn't take it, just to get a sense? Susan says they don't remember. That's okay, Susan. Someone said define health education. Love that, Rachel. So I think of health education as having the knowledge, skills, and attitudes to respond to new and unfamiliar and novel situations as it relates to your health. Sasha says 12th grade with the water polo coach, tight. Esther said never thought of it. Well, that's okay, Esther. I'm glad you're thinking about it now. Josette said I did, but it was super abstinence-based and heteronormative. Thank you, Josette. So let's go ahead and move on to the next slide. So for those of you who did receive health education, did your health education program, curriculum, or school ask for your voices, your opinions, what you would be interested in building that curriculum, or did they ask that of your peers? So the statement is, yes, I or my peers' voices were built, reflected, and are invited into the work around health education. Go ahead and put a Y. And if it wasn't, go ahead and put a no. Oh, doesn't seem like there's a mixed bag here. All right, thank you for that. Is anyone willing to share in the chat box how that impacted them? What was it like not to have your voices built in to the health education curriculum? I'm hearing from Josette, it was very heteronormative, right? So maybe that was not a very good experience, not being representative of the people in the room, not feeling relevant. Anyone else? A no, absolutely not, Deetra said. I went to a Catholic school. Anyone have issues with relevance? Was the information something that you can use in real life? Chris said, didn't answer any of the questions I had or was curious about. So I would propose, Chris, they didn't answer any of the questions you had or were curious about, probably wasn't a very engaging opportunity to learn and use that information in real life. Fantastic. So we're gonna go ahead and move to the next slide. Feel free to continue jumping into the chat box, but this is kind of the reason behind why Peer Health Exchange seeks to build youth voice. Inviting and engaging and centering the voices of young people is so important because it can help us increase the likelihood that the programming and products created meets their needs in real life and in equitable, relevant, meaningful, and impactful ways. And that's pretty much the driving force behind why Peer Health Exchange seeks to open up outlets to build in the voices of young people. That being said, here are 3 ways, very high level, excuse me, folks, that Peer Health Exchange seeks to build in youth voice. One of them is design labs, which involves young people sitting through or completing some of the workshops and modules that we provide through our programming, and then asking them their feedback around what worked, what didn't work, what would they like to see change. Another place that we do that is through evaluation. And so things like impact assessments and focus groups are 2 evaluation activities facilitated by our amazing Peer Health Exchange's brilliant senior manager of program and evaluation and systems, Lexis Manzara, to pull in young people's feedback around their learning, their experience, and their engagement. The last one is youth groups. And so this past year, Peer Health Exchange had the opportunity to work with young people from both the Youth Advisory Board, which was comprised of 9th grade students in California, as well as our Youth Design Group, which is comprised of high school students across the nation, to inform, provide feedback, and tell us more about how we could be more responsive in the ways that we develop programming and products. So you're gonna go ahead and move on. Oh, and these are the people behind the work. So Lexis is at the top. Moving down is Chris Wilson, Jackie Maloney, and the amazing Lisa Walker. They were pioneered work around working with the youth design group to build prototypes related to direct to youth. Also, Dr. Angela Glimp Austin and one of our amazing youth advisory board members, Brandon, were featured, I believe, in the March Shape podcast, where they talked about health equity. So those are some of the examples that demonstrate ways that young folks have recently had their voices pulled into the work that we do, and the adults behind that. Woo, I can see you all applauding. So in addition to that, in addition to youth voice, excuse me, there were some other design and development principles guiding the work behind we do what we do for each one of our curriculum. So many of you may know one of our outcomes is to really build knowledge, skills, and attitudes and intention. By intention, we're talking about not only do I have the knowledge, skills, and attitudes, feelings, thoughts, belief that I feel like I can, but also will I? And so that is the outcome that we're looking to measure. Those are the outcomes that we develop our curriculum around as a way for increasing a student's likelihood to take care of, maintain, and seek resources for their health, as well as build healthier communities. There's also very much so emphasis on skill development, right? So you can have all the knowledge in the world. I always use the metaphor of a bike. You can know what a bike is, you can know what pedals are. In theory, you can know how to, operate a bicycle, but if you don't get that skill, that practice in using the bicycle, knowing what the bike is pointless. And so a lot of all of the curriculum that we design are really focused on building those skills. Again, I believe what someone who asked earlier as it relates to health education, so young people have the information that they need to respond to novel and unfamiliar situations in real life. Access and agency is another emphasis through all our curriculum. So it's really looking about not only what can I do as an individual and that I do have power, meaning I can influence and make decisions for myself, but what does that look like collectively as a peer group, as a group of ninth graders, as well as access, right? How do we plug young people with the information, skills, attitudes, and intentions that we have, or that they have, into the experts who actually do the work and provide those health resources and pieces of information? For those who aren't familiar with peer health exchange, we utilize a near peer model. And so really the secret sauce behind that is bringing people in with proximal lived experiences, not only to be able to provide immediate coaching and feedback in relevant real ways, but to also use modeling of their own successes and challenges as it relates to the content and being able to use knowledge, skills, attitudes, and intention for health. Our work is also informed by evidence-based pieces. So we look at trauma-informed approaches as well as positive youth development principles, harm reduction, again, the voices of young people to get a sense of how do we create something that's going to be impactful and meaningful. So although we're very creative, it's not a guessing game, it's not a notion. A lot of research and work goes behind in being able to create something that's actually going to work. Excuse me, folks. And last but never ever least, we seek to center equity or remove those barriers to a young person's full and active participation. Students, their interests, their aspirations, their goals, and the questions that we ask and the activities that we do, as well as relationships, because we know one barrier to accessing health resources and information is for young people being able to trust the person that they're talking to or seeking help and support from. And so those are the principles behind the work that we do that informs our curriculum. That being said, we're going to move to the next slide, and then I'm going to pass it over to the amazing Kavita Shah. So here, for this year, we actually have 3 curricula that we're offering. One of them is Pathways, which is known as our traditional, what people know as a regular standard health curriculum that's really designed to give students the knowledge and skills they need to make healthy decisions. It focuses on the core health skills of reflection, analyzing influences, communication, decision-making, accessing resources and advocacy, as well as covers health content and information in mental health, substance use, specifically alcohol, and sexual health. The newer programming or newer curriculum that we're offering this year includes Bridges. Bridges really takes those core health skills and seeks to build them as a way to increase and introduce a young person's perception and interest to their potential as a leader. And so Bridges is really focused on young people being able to walk away using those health skills and applying them to say, I can inspire, influence, and motivate change for health, because we do know young people have agency and they are powerful. And then today's focus, of course, is Centered. And so Centered really looks at building the same knowledge, skills, attitude, and intention, but this time with the focus on SEL competencies to increase a student's likelihood to take care of, seek, and maintain resources for their mental health. And so without further ado, oh, I'm sorry. Thank you so much for that, Richard. KSI or KSAI means knowledge. So information, skills, what young people are able to do, attitude, so a feeling, a thought, as well as intentions. Stigma is a really good example of an attitude that might inform how a young person acts for their health. And SEL stands for social emotional learning. Thank you so much, Shelby. I speak in acronyms so much. Richard, did you get your question answered? Okay, so without further ado, I'm going to go ahead and pass it over to Kavita Shah.
Awesome. Hi, everyone. Again, my name is Kavita. My pronouns are she, hers, and I work on the design and development team with ECO. And I'm here to talk to you today a little bit about Centered, which, as ECO mentioned, is our program that's designed to increase students' likelihood to take care of, maintain, and seek resources for their mental health. This is a program that was really conceived in the heart of the pandemic as a direct response to needs that were expressed by our partners and by our students. And so it's something that is very close to my heart just because it is, I think, one of the most relevant programs that has come out of PHE and is really specific to the times and what we've heard our students are experiencing at this moment. So the program actually integrates practices from a lot of different things in addition to just transformative SEL or social emotional learning. We also integrate mindfulness practices, meditation, and cognitive behavioral therapy tools to really provide students with a toolkit for mental health that's applicable to their day-to-day lives. And so rather than some of the prevention type programming that ECO mentioned in Pathways, Centered is really focused on sort of what are healthy habits that our students can build in the day-to-day that they can actually take home right when they get out of the virtual learning space and are interacting with their friends and families. So one of the, I guess, some of the examples of healthy habits are like journaling and mood tracking, things that are really honing student self-reflection skills and just creating tangible things for them to link onto. And you'll see a little bit more of that from Shelby and Kavi in a little bit here. But what you're seeing on the slide at this time is the SEL framework. So for those of you who aren't familiar with social and emotional learning, this is really hot right now in education. And I think that our program really came out kind of against the backdrop of a lot of other SEL programs. But what is really distinct about Centered in and of itself is that it has a really deep focus on identity and on agency. And so the first two introductory models that are highlighted in orange up at the top are really designed to ground students in sort of who they are and how they think about themselves and how they think about their own mental health, because it's so varied from person to person, how they understand their mental health. And then every module that happens after that is based around a specific social and emotional learning competency and how that particular competency can help to support a student's mental health. So it's a really deep dive into explicit skills instruction, but it's just filled with lots of small tools that make the learning really bite-sized and easy for students to latch onto. So if you click to the next slide, one of the things that I think is really helpful is just sort of drawing the connection between each of these competencies to mental health. And so if you click through, this diagram really shows kind of the way that manifests in an individual's experience taking care of their mental health. So if you look on the left-hand side, this is really where we see a lot of the self-awareness and self-management competencies emerge. And so we really are trying to build a student's ability to know themselves well enough to understand when they're struggling and also be able to have the language to express that to someone else. And then what the arrow is pointing to is really the self-management piece, which is that, okay, I know that I'm struggling. I know that I'm feeling anxious. What are some coping mechanisms that I have that work really well for me that I can use on my own and that don't necessarily need the involvement of anyone else? And so this is cultivating students' ability to manage any anxiety that comes up, any stress that comes up, sort of things that are more on the day-to-day that might just happen in a moment's notice. And then what you see on the right-hand side, this is where the social awareness, relationship skills, and responsible decision-making competencies start to come in, because this is a student's choice moment where they see that they're struggling with something in a way that they can't necessarily help themselves. If they're experiencing the warning signs of poor mental health that indicate that they might actually need professional help, what we're doing is really pushing them to understand, like, what is the support system that I have available to me? How do I cultivate strong relationships with those people in my support system so that I make sure that they're available whenever I need to express my needs? And what does it really look like to access a relevant resource and be able to communicate my feelings in a way that's going to be understood by someone else. So as you can see, all of these competencies are really applied. I will say that kind of looking at the framework on the previous slide too, it's important to understand that there's how SEL operates on an individual level, and then there's also sort of the systemic context that SEL exists within. And it's really just essential to understand that while PHE as a program is always going to promote access to health resources, it's also really essential for us to make sure that our students are feeling a sense of agency and feeling a sense of confidence so that they can actually apply these skills and get the help that they need. So on the next slide here, as I mentioned, one of the things that's really unique about Centered as a program, I think against the backdrop of other SEL curricula, is just that every single one of these modules is facilitated through the lens of identity. And so we acknowledge that students have really complex and intersectional identities that are going to impact their sense of confidence in interacting with mental health care resources, and even just really varied experiences of mental health depending on who they are and how society perceives them, which I think is something that we can all relate to. So very early on in the program, we name these forces of power and privilege and oppression, as well as marginalization and trauma, and really give students space to observe their lived experiences with mental health through a racial context, first and foremost, but also as it relates to other other aspects of their identity and just sort of a greater socio-political context. And this is something that Kavi and Shelby will also probably speak to, but it's just really essential for us that in every time that we pose a question to students or introduce a tool to students, that part of the Centered curricula is really not only just understanding how to use the tool, but understanding, like, does this tool work for me? Like, how does this show up for me culturally? How does this show up for me in my home life? How does this show up for me in my family life? And that exercise of self-reflection kind of in the workshop space, and then learning empathy and learning that sort of social awareness where students are interacting with each other around sort of how their identities are different and their experiences are different, I think is really the bread and butter of this program. That being said, one thing that I'll leave you with before we jump to sort of the concrete activities, so you can really see this in action, is really just that we acknowledge for students that these SEL skills, we are training and developing them in these SEL skills, not because they're going to fix or remove any sort of systemic inequities that are impacting their day-to-day lives, but really just that they can help sort of mitigate the stress of systemic oppression that a lot of our Black and Brown students, which is the majority of our student demographic, are experiencing on a day-to-day basis. And so we're really just trying to build a sense of strength and resilience and power for our students so that they feel safe in themselves in maintaining their mental health, despite kind of the dynamic and tumultuous environment in which they are being raised and going to school. So with that being said, I'm really, really excited to pass this on to Kavi and Shelby so that they can share some of our activities with you, and you can get a sense of how this looks in action. So thank you.
Thanks, Kavita and Dr. Eco. My name is Shelby. I use pronouns she and her. And I'm about to show you, Kavi and I are about to show you, a sneak peek at what our curriculum actually looks like. Before I move on, I wanted to let Kavi introduce themselves as well.
Hi, sorry, this is always awkward when I'm like not the first person speaking. Hi, I'm Kavi. I work with Shelby. I'm a Commonwealth Core Fellow, as is she. I use they, them pronouns, and I'm coming in from Boston, and you'll hear from me in a bit.
Thank you, Kavi. Yeah, so Kavi and I both work out of Boston. We are fellows who do a lot of teaching. So we are in the classroom, in the virtual classroom space, sometimes up to 10 times a week. And we teach in various different Boston public high schools. So we're gonna talk today about part of our centered curriculum, like you heard Kavita talk about. The structure of all of our modules are all very similar. They kind of go from an introduction, they segue into content, and then they wrap up with skill application. And so right now, Kavi and I are going to run through selected slides from our centered curriculum, specifically the module called Checking In with Yourself. So recognizing emotions is the first part, and it hits on two big parts of what Kavita alluded to, self-awareness and self-management. We usually use this slide here to talk about how to recognize our emotions and what emotions our students are feeling and why. And so just as a warm up for all of you guys who are here with us in the call, this is a real question we would ask our students, and I want to ask you all, how are you? Put in a word in the chat to describe how you're doing today or in this moment. Happy. Well, I'm glad to hear that. Nancy, okay, we've got tired, productive, exhausted, better than yesterday. You know what? Sometimes that's all we can hope for. Tired, yeah, definitely feel that. Inspired, yes, Stacey, love to hear it. Amy's happy, focused, hopeful, good, yay. Weary, tired, but happy. Peachy, a bit hungry, but good. Thriving, great. These are all wonderful. And I'm really impressed and struck actually with the variety here of naming different emotions. Normally when we ask this question to our students, we get a whole bunch of good and okay and fine, which is to be expected, something that we're socially conditioned to kind of say. But this is an opportunity to sort of really reflect and ask, like, how am I doing? And on the next slide, you can see, well, thank you so much, everyone, first of all, for sharing how you're doing today. Appreciated. On this next slide, though, this is a tool we provide to our students called the Feelings Wheel. Sometimes the question, how are you, is easy to answer, and sometimes it can be harder to answer. So we present this tool to students to help them quickly and accurately describe how they're feeling. To use this tool, what you do is you can look at all three rings or all three levels of this wheel to find a word that resonates with you today, or just seems true to how you're feeling. Once you find something that sticks, you can move toward the center or away from the center to find other words that might more accurately describe how you're doing. So as an example, you could start with feeling happy. I know a couple of you said happy, and then you could move to the outer ring. And so you might be feeling interested or very inquisitive about all the things that I have to say today. On the flip side, you could start from the outside and start with feeling, you're feeling overwhelmed, move to anxious, and realize that at the root of all of that, there's really just fear. So it really is a great way and a great tool to explore language, to accurately describe emotions. So it's helpful to know why we start to feel a certain way. So after we name our emotions, it's important to understand, why we start to feel that certain way. And so we also introduce a framework and a tool that helps students to recognize signs and regulate their emotions if they come up at an inconvenient time. And that is when we introduce the zones of regulation. So I'll give you a moment here to just kind of absorb what you're looking at. You're looking at 4 different colored zones. And what we say to our students is we can think of our emotions as categories or colored zones. There are 4 zones, blue, green, yellow, and red. Each of these zones represents a different kind of alertness or a different level of alertness. And so blue would be your lowest alertness. You would maybe associate emotions here like sad or disappointed, maybe tired or bored, or just slow moving. You've got your green zone. This is your ideal zone, right? Many of you mentioned feeling happy or grateful. That's a great green emotion. You might feel calm here, focused, or good generally. And then you have your yellow zone. Yellow zone is just slightly elevated, a little more slightly alert. I felt more in the yellow zone right before this presentation. I was getting a little anxious, a little nervous, but like mostly excited for the presentation. But you can also feel frustrated here, maybe worried or excited. I know I mentioned I felt excited or distracted. And then the red zone. This is the most extremely heightened out of control zone that really we want to avoid. And so although it does happen, it comes up for everyone. And so in the red zone, you've got angry, scared, reactive, panicked, or out of control. And throughout the day, all of us move from zone to zone based on different things, based on social, physical or other triggers. Maybe, you're feeling yellow, maybe you're feeling a little agitated, you have a good meal, you get back to your green zone. Maybe you're feeling blue, a little tired, you have a nap, you're back in your green zone. Or maybe you're in your green zone and something really sets you off. Maybe something ticked you off at the gas station or at the grocery store, and now you're in the yellow zone. So things happen all the time that change us from zone to zone. But what's important to also note here is that we have the power to move ourselves from zone to zone too. And so if we can recognize if we feel a certain way, then we can also recognize what we might need for that given situation. So after we introduce the zones of regulation, we introduce this framework. And this is an activity that might seem a little cheesy, but it's a great way to check in with yourself and self-regulate. And so we just invite our students, and you can try this yourself right now, to fill in the blanks. So an example here could be, I feel irritated because I haven't eaten yet today, so I need to get a snack. Or it could be something like, I feel exhausted because I have a lot of work to do, so I need to take a break. So there's a lot of different ways to kind of think about our emotions and understand our power in our abilities to regulate ourselves. Does anyone want to try one? They can use the chat to fill this out. I'm going to give a moment just to kind of invite some interaction here from the audience. Just leaving some space for anyone to try filling in their blanks. Okay. Yay, great, thank you. So I've got a couple here: feeling satisfied because my day is going well, so I need to feel grateful. I feel tired because I didn't sleep much Sunday night. Oh, I lost it. Oh, so I need to take it easy and go to bed early tonight. These are wonderful examples. I'll read one more. Let's see, I feel weary because I had a trying day, so I need to rest and relax. Wonderful, these are great. And if you want to read over some others, feel free. This is a great exercise just for yourself, but also to kind of read what other people are going to do for themselves today to take care of themselves, to get some inspiration. Wonderful, okay. All right, and so this last piece here of my section is, we ask our students to reflect. And this really hammers home skill building. So I'll give you all also a moment to just reflect on these questions. We will pose these to our students and ask first for them to think of a specific time where they successfully regulated their emotions before this workshop. Maybe a time where they calmed themselves down, or they wanted to yell at somebody, but they didn't, and they had a conversation that was mature and level-headed instead. We like to hear from 1 to 2 students, usually around this time, to have them share their story. And encourage them to use that framework of I felt X because Y, and so I Z. We want students to reflect on how they already do this, because our young people are so smart. And that's really what we want to kind of leave them feeling with, is that they already have the skills to do this. They already know what to do. We are just naming, clarifying, and giving labels to things that they are already capable of and do in their daily lives. And so that's enough for me. I'm going to hand it over to Kavi, and they're going to take us to the end.
Thanks so much, Shelby. Yeah, so a lot of great content, a lot of really good information and ways for students to connect with themselves, what they're feeling, and but give names to, their ability to regulate that, to connect with themselves, connect with others, all that good stuff. So as Kavita mentioned before, as good as the tools we just explored are, sometimes young people, and all of us, experience feelings and emotions they can't manage on their own, which means they might need to ask for help. So our centered curriculum, as well as peer health exchange curricula writ large, is very skills-based. And one of these skills is recognizing when you need help and knowing how to do it. So the second piece of this is really building out those skills. So firstly, we ask our classes what things might come up for young folks that may be hard to manage on their own. And I'm going to ask you all that as well, if I could get a couple of folks to participate. So what kind of events, experiences, et cetera, do you think could be coming up for young people that makes it hard for them to manage their mental health alone? Feel free to think of any young people in your life. Uncertainty. Yeah, that is a huge one. Racial violence, yep, isolation, remote learning, gun violence, all really, really hard things. Not being able to see their friends, financial insecurity, canceled events they were looking forward to, them or their family members contracting COVID. There's a lot of huge things going on right now. There always are, but I think especially now, especially in a virtual learning time, stigma, peer pressure, not knowing if they're struggling, being left out, all of these are fantastic answers. And I think a lot of these things are what's been bouncing around in young people's heads, trying to make friends, whole bunch of stuff is coming up. Yeah. So again, bringing us back to that main point that we were talking about earlier with identity. Yes, there are teenagers, these are teenagers and young people that we're talking to, but there are these really giant systemic role issues playing large roles in their lives. I think sometimes it's easy to think of young people as, you know, they experience more trivial day-to-day things, but really, as we were speaking about earlier, as Kavita and Iko mentioned, like so many systemic forces are affecting all aspects of students' lives right now. So really taking the time to elevate their identities and recognize that so many of their day-to-day experiences are based on and influenced by their identities along race, ethnicity, class, gender, etc. And they're a part of students' lived experience. So again, that is creating the backdrop for this conversation. So as we have students reflect on how they're feeling, why, how they can help themselves, really also recognizing the role of oppression, power, and privilege. And again, normalizing the idea that, you know, a lot of people struggle with their mental health at some point, and to lessen some of the stigma around that. All right, so we have some examples here. You can just go through all of these. A lot of folks were calling these out in the chat. So again, things like financial strain, illness, loss of a loved one. COVID is hitting people really hard. So thinking about that as well. So again, one of the skills that we want young folks to be comfortable with using is recognizing when their mental health is poor and when and how to ask for help. So we go through some warning signs and stress that if signs and symptoms persist for more than 2 weeks, they may want to think about getting help to manage their mental health. Oftentimes in the classroom, I'll ask the host teacher the names of school counselors to give a starting place for students who might want to reach out and may not know those names off the top of their heads already. I think tying that in and personalizing it, there's so many wonderful places in this curriculum to do that. And I think it really hits home for students and helps them make these connections in their lives outside of the computer screen. Cool. So because some warning signs involve things like self-harm, suicidal ideation, really unhealthy relationships with food, we make sure to give a trigger warning so students can be prepared to receive this information or step away for a moment if they need to, recognizing that it is important to speak about these things and give voice, give name, but also allowing students the space to step back if they need to, and really honoring like their own processes and their own agency. Okay, so I'm not going to go through all of these, but I'll give a second for folks to read what's on the screen. Again, written and delivered in a very easy to read format, things that students may have seen in media, in their own lives, in lives of others, and just kind of a baseline to think of, oh, hey, you know, maybe this is indicative of something more serious and maybe I should reach out and get help. And again, really stressing that doing badly mentally can look different depending on what your normal is. So really connecting back to the piece that Shelby mentioned earlier, the importance of starting all of these conversations with self-awareness, thinking back to that two-tiered diagram that we went over before during Kavita's section, just thinking about starting with self-awareness, and then when you know that you need help and you don't have the tools or the skills to do it on your own, to feel comfortable reaching out. Obviously also elevating that some of these more serious symptoms should be addressed immediately. Like 2 weeks is not a guiding line. It's an idea and a place to start, but obviously if intense things are coming up, that students should feel free to reach out for help. So along the lines of decreasing stigma, of seeking help for mental health, we draw a parallel between physical and mental illness. So the example that we give to students is if your throat feels sore one day, you may just need to drink some tea, get some hot coffee, probably not coffee, but something warm, just a lot of water. But if it persists for an extended period of time, that magic 2 weeks or fewer, you may want to see some professional, something bigger might be going on, all of that stuff. And really paralleling this to the experience of mental illness and just mental health in general. So similarly, we elevate if the warning signs persist, students should talk to a trusted adult. I think that drawing this parallel can be really helpful, especially if students have never really delved into mental health in a health class before. I know I didn't in high school. I know based on a lot of the answers that we saw in the chat earlier, a lot of you all may not have either. Personally, at this section, I usually throw in that I've been in therapy for 3 years and it's made a positive impact on my life. I know I've spoken with a lot of other facilitators, and I think that personalizing this content goes a long way. I know a lot of people do similar things when going through this module. And then again, we really stress that regardless of any sort of professional mental illness diagnosis, if young people are struggling, we want to make sure that they have the tools and the knowledge to get help. So, last piece of this, bringing back to the skill building reinforcement. All centered sessions end with a journaling prompt to establish a through line with all of the content, and also to standardize the structure of how they're delivered, give students a beginning, middle, and end of each workshop. So this journal prompt, how are you feeling? Which zone are you in? Which zone do you need to be in? And what do you need to get yourself there? It's a great opportunity for students to think back to the tools and the little diagrams that we discussed earlier and how that really shows up in their own lives, gives them the chance to check in with themselves, take some time to reflect on the power they have over their own reactions, their own moods. Journaling is also another opportunity for students to connect their lived experiences in society with these tools and how best to help themselves. Oftentimes, deep conversations do happen in the classroom, but deep conversations also happen when young people can take the time to absorb, digest, and apply the information that they learned to their own experiences. So again, reflecting on their own power and confidence, in my opinion, centered, and really all of the curricula, no, they don't just pay me to say this, is able to reach so many young people because of all these ties to things that they're experiencing in their day-to-day lives. All the young people that we work with, younger people, students, people out of school, everybody, so smart and so skilled. And oftentimes these skills are akin to things that they're already doing, but giving them names for these processes and maybe more language to discuss how they're feeling is paramount to seeing improvement in health behavior. And also just making young people feel better about themselves and more confident. And that is really our goal at the end of the day. So lastly, we check for understanding and answer any lingering questions. And the goal here, again, making sure students get the most information possible. So we have this lovely question slide. And with that, I throw this out to all of the lovely audience members. Do you all have any questions? And that is the end of my spiel.
Hi everyone. My name is Evan. I use she, her pronouns, and I get to work with these fabulous people. We have had some questions come in over chat and beforehand. So I'm gonna kick us off and kind of start with Iko and Kavita. Can you share a little bit more on how peer educators are equipped to respond to, as Kavi highlighted, some of those needs that require more professional services?
I'm looking at you, Kavita. You want to take the first one? I'm just looking at you.
Well, it's sort of a mix of things. Yeah, I can start and then feel free to add on if you want. But students are typically able to ask questions. And one thing that we try to do is foster a partnership between the host teacher and the volunteer health educators in the classroom. So that way we know that there's always sort of a trusted adult that has more of a connection to the school resources that volunteers can sort of defer to. And so a lot of times if things come up that are of a more heightened concern, we just ask them to pass that information along to the host teacher so that the host teacher can actually be the one to do sort of the troubleshooting and finding the correct resources that are immediately accessible to students, so the onus doesn't fall on the volunteer.
There, I see Susanna already asked a follow-up question to this around can young people ask questions anonymously in the virtual setting, knowing that that was part of our in-person work?
So Suzanne, oh, go ahead, Kavita.
No, you go.
So Susanna, it was something that we looked at in the beginning, but given the role of the health educator as a volunteer was decided organizationally that students answering anonymous questions probably wasn't such a great idea for purposes of not being able to follow up with them. So what we really want to do is center those relationships and encourage students to be comfortable enough to share stuff in the space in a way that we can provide them with the information or resources that they would need. But yeah, we don't answer questions, student questions anonymously in the virtual setting. Did I answer your question, Suzanne?
Well, I guess a quick follow-up to that is, can they ask a question not anonymously, but that the other student, so the health educator knows that it's their question? I guess privately maybe is the other word, that they can ask privately so that the other students can't. Okay, that was,
Yeah.
So like private chat is a great way to ask a question.
Yeah, that's a great question. And Kavi and Shelby also might be able to speak to that just in case it's come up in the classroom. But I will say that that has been something that we've observed in a lot of our health educators this semester, is just that they mentioned to students at the top of the class, like if you have a question that you don't want to share with the whole group, you can always make use of the private chat. And also some students, it's even just the differentiation between participating audibly and in the chat. And so they'll feel more comfortable writing it down than saying it aloud, even if it is exposed to the whole group. And then an educator can just sort of like sweep it into the conversation and address it without necessarily calling the person out by name.
Oh, Kavi, thanks for sharing that already. The next question is for Shelby and Kavi, for you two. What do you like most about teaching virtually? Like, how has it been for you two as people doing this work over the internet?
I can start with that one and then I'll pass it to Kavi. You know, it was definitely something that I was nervous about moving into this year, being virtual and not being in classroom space. I had never done health education in person or online. So I was like, how am I going to do this? But I'll tell you that it's been really rewarding. I think mainly because I've felt like, you know, I've really been able to show up for young people in a year that's been really, really difficult. There's been so much social isolation for the young people in the populations and communities that we serve. So being able to just show up for an hour in their homes when they're on their laptops and talking to them and engaging them in meaningful conversations around identity, mental health, sexual health, relationships, has felt like the right thing to do during COVID, during quarantine. So I think that's been incredibly rewarding. And also just seeing when students light up around certain topic areas and have, you know, when we actually do have those breakthrough moments where we're having real conversations and applying those concepts that we present to people's daily lives has been just, you really can't put like a price on any of that. It's really, it's incredible. So that's been my favorite part of doing this work. I mean, virtual facilitation is like less than ideal, but it's also been like our only option right now. And I think it's been getting through to kids. So I've been really thrilled to be a part of it.
I love virtual facilitation. I just seconding everything that Shelby said. Also, as a very awkward person and presenter, I think that being able to sit cross-legged in my little foldy chair and talk about things has been really awesome. And I think that I've been able to have a lot of really great, like more peer-to-peer conversations. I think staring at everybody in their own little Zoom squares. I also only have one Zoom square. I think it breaks down the hierarchy a little bit more than even being in the classroom would. I feel like less of an authority figure and more of like a thought partner. Huge fan. And also I'm seeing in the chat, how do you gauge student engagement? You know, it's $1 million question, isn't it? It is $1 million question. It really depends. I think that we were kind of hinting at it earlier. A lot of students do participate in the chat. Definitely we have, I would say majority of my classes, most students prefer to participate in the chat. Always fun icebreakers. I gauge student engagement like that because at the beginning, everybody will be like, I want to answer my favorite donut flavor. And then I'll ask them an actual serious question and no one will respond. So I think there's ways to see like what the engagement level is, but also understanding their students. They're tired. This is their 4th class of the day. They're sitting on their laptop. They've been staring at a screen for 6 hours. Like it is complicated. It is hard. And I'm thankful for like every time that people do participate. Some classes are better than others. But yeah, virtual facilitation has been blessing and a curse, but I think it's really been an amazing opportunity to get to connect with students, and also we can teach back-to-back classes like that. So I think for me, it's a lot easier than having to like run down the hallways of a school or like be on public transportation in the middle of the day, things like that. So I think logistically, some things have been solved as well.
Agree. And one more thing I'll add too is that in order to gauge like our classroom participation or engagement, a lot of the time it will fall to just checking for understanding. And so a lot of times we're using the chat feature, we'll ask students to say like +sign if you're with me, +sign if we can move on, which, you know, is a way to read the room per se that we wouldn't be able to do virtually. You know, you wouldn't normally be able to do in person, but sometimes a lot of students will have their cameras off. And so that's what it sometimes falls to. But yeah. And that usually works and students are responsive.
Can you guys each share a little bit about, are you seeing certain student needs come up over and over? Like, are there some activities or some workshops where you're like, okay, this is, this is going to get a lot of reaction, or certain.
My instinct, my gut response to this one is like our relationships and boundary setting have been huge for students. They really latch onto that material, I think, because it's so directly applicable to their lives. In some cases, when we talk about like sexual health or even alcohol or substances, we're speaking to some students in the classroom, but other students have not experienced these things yet. And when we talk about mental health, I think that is preventative in some cases and also like intervening in others. But when we talk about relationships, like everyone is in like at least one relationship, I can assume. And so it's really, really cool to watch people light up and think about how they interact with other people in their lives that they care about, and how to do it in a healthy way, and how to keep it sustainable and make sure that they're being heard and supported. So I think for me, like I've noticed that we have like the most robust conversations when we talk about like how to set boundaries, how to ask for what you need, and generally talking about relationships.
Yeah, echoing that, students love to talk about their friends and like situations that they've been in. I know this is not centered, so I'm so sorry for going slightly off topic, but a workshop that I did today, asking questions about alcohol and about relationships. And then we had like a whole conversation about what that looks like how to support a friend in a situation where you don't know how they're going to react, and like how to put other people's needs before their wants. And I don't know, I think that really there's so much that students that are 14 know that I definitely didn't know when I was 14. So it's a fantastic environment, and it's been so amazing to like hear from them and hear what's actually going on in their lives. Oh, so a lot of times students will bring up things offhandedly, or host teachers will, and it's a little awkward. But I think that there definitely are conversations about like, oh, what is this? How does this look for you? I know when we talk about relationships, oftentimes we ask like, how has this changed during COVID? Like, what supports have you needed that maybe you didn't need before? Or what do your relationships look like now? How have things changed? And I think that there's really a lot of room for students to be able to share how things have changed for them, how things feel right now, fully well knowing that like it is a peer space and we are having these conversations. I do think that some students shy away from like really just dumping harsh things sometimes. But I mean, I've talked about COVID, I've talked about racial trauma, I've talked about illness and death in the family with students. Like things come up because once you open I'm so sorry, it's so loud outside. Once you open the can of worms, students really do want to talk. And I think that's my answer to that question. Sorry, that was kind of long-winded.
No, it's fantastic. And thank you both. Okay, we are coming up at the end of the hour. And so I want to say thank you to you all for joining. Thank you, Dr. Iko and Kavita and Shelby and Kavi. Thank you everyone who is on the call and joined us for this last hour to learn more. If you're wondering what comes next, there are two kind of challenges or commitments that I have for you. The first is to share. If you learned something today or excited about something you heard on this call, share it with someone in your community. Share it with a friend, a neighbor, family member. And the second challenge I have for you is dive in, engage with us. More is coming from Peer Health Exchange. We have done big, bold things, and we're going to keep doing big, bold things with and for young people. And we want you to join us. So we're excited to keep talking and sharing and working to build healthier communities for young people. Thank you again, Dr. Iko, Kavita, Kavi, and Shelby. Everyone, please take care of yourselves and be well. Thank you.